Good day everyone, I'm Siti Nur Amani with my team members Siti Nur Soleha, Siti Nur Aisyah, Nur Atira Kaisha, Siti Nur Iza Shakira and Nur Husnina Kamra. Today we are going to present about cancer treatment in Malaysia. Nowadays, the use of nanotechnology in the medicine area is no doubt anymore. The development of nanotechnology is impressive since it can improve high sensitivity, specificity, and multiplex measurement capacity. It therefore been investigated for detections of extracellular cancer biomarkers, cancer cells, and in vivo imaging. Next, the conventional method that widely used are X-ray, magnetic resonance imaging (MRI), computed tomography (CT scan), endoscopy, and ultrasound. However, they can only detect cancer when there is visible change to the tissue. But since we have nanotechnology, the cancer diagnosis can be done by applying nanoparticles to capture cancer biomarkers like cancer-associated proteins, circulating tumor DNA, circulating tumor cells, and exosomes. The advantage of applying nanoparticles in cancer detection, it can improve the specificity and sensitivity of an assay. This is because of their large surface area to volume ratio relative to bulk materials. Due to these properties, nanoparticle surface can be densely covered with antibodies, small molecules, peptides, and aptamers. These moieties can bind and recognize specific cancer molecules. By presenting various binding ligands to cancer cells, multivalent effect can be achieved as well as increase the specificity and sensitivity of an assay.
The current state of science and technology development of bioscience technology in Malaysia, which involve the universities, government ministry and agencies, and also industry. First, university. There are various establishments of well-equipped nanoscience or nanotechnology research centers, such as Ibn Sina Institute for Fundamental Science Studies (IIS). There are also increased number of postgraduates in nanoscience or advanced materials in Malaysia. This situation happened especially when the government has introduced the National Science Fellowship Scheme. This scheme is a scholarship awarded to excellent students to pursue full-time postgraduate studies in science, technology, and innovation. Next, government. Government Malaysia's national biotechnology policies aspires to turn the biotechnology industry into one of the country's most important economic contributors. This statement can be proven by looking at the landscape below, where the Malaysian verified nanotechnology product market revenue is expected to increase year per year till 2025. There are also nanotechnology programs such as iNanovation. iNanovation supports and empowers small and medium enterprises to establish a foothold in the industry and grow their market share. Next, there are also an agency under the Ministry of Science, Technology and Innovation, MOSTI, named as NanoVerify Sendirian Berhad. This agency is mandated to monitor and facilitate nanotechnology development and commercialization in Malaysia. The benefit of this agency is, first, to ensure sales of genuine nanotechnology products. This situation will boost customers' confidence and trust toward the product. Second, it will create greater market acceptance toward the product in other countries. Next one, industry. Nanomedicine produces precise solutions for disease prevention, diagnosis, and also the treatments. By nanotechnology, a better imaging and diagnostic tools has been produced. Moreover, recently, nanotechnology researchers are working on a number of different therapies and also looking at ways that nanotechnology can improve vaccines, including how vaccine delivery can happen without the use of needles.
I am Atira Kaisha. So next, I'm going to talk about the current state of science and technology development of nanotechnology in cancer treatment in Malaysia. For university section, firstly, researchers from the International Islamic University Malaysia have developed a tumor biosensing chip that can help determine the optimum dosage of chemotherapy for a cancer patient. The miniature chip uses cells derived from cancer patients to screen reactions to different drugs and dosage. It measures the growth and death of cancer cells electronically, and the results are transmitted wirelessly in real time. Secondly, researchers from University Malaysia Pahang also developed the Triple Negative Breast Cancer Research Project to treat breast cancer using nanotechnology. They produce anti-cancer drug that has the potential to detect and treat TNBC more effectively. The formulation is good compared to conventional medicine, as the dose of nanomedicine used is much lower by targeting predict release. This anti-cancer drug is formulated in the form of nanoparticle fluid. Nanomedical applications will help the delivery of the anti-cancer drug directly to cancer cells without affecting normal cells. And at the same time, this drug will release a diagnostic agent to cancer cells. The diagnostic agent will continue to travel to all tumor areas through the bloodstream. Therefore, the patient's condition can be monitored from an early stage. For government and industry section, Nano Malaysia Berhad is Malaysia's lead agency responsible for the commercialization of nanotechnology in the country. Nano Malaysia was incorporated by the Government of Malaysia as the special purpose vehicle to spearhead the growth of national nanotechnology sector. Nano Malaysia Berhad was incorporated as a company limited by guarantee under the Ministry of Science, Technology and Innovation. One of their key strategic sectors is wellness, medical and healthcare. To develop innovative products and nanomedicine experts in Malaysia, IBM Research and Nano Malaysia had embarked on a joint research program to develop nanogel star polymer-based materials that will ease access to antimicrobial coatings and drug delivery applications, which give a big impact in the cancer treatment.
I am Siti Naisha Binti Bakri will present about examples of how the driver play a role in sustainable development and also some examples from other countries. Undeniably, nanotechnology has played a role in sustainable development, and in order to maintain it, the health of the people comes first. Once the explorations in nanotechnologies have been done, we can find that it can contribute to curing once incurable diseases and enable quick response to health crises, which is related to decent work and economic growth. This contributes to healthier workforce and produce more productive labour forces due to less hospitalisation, career interruptions and school and work absenteeism. Nanotechnologies have been used for decades ago to treat cancer and increase the survival rates of cancer patients. Early detection is crucial to treating cancer. However, it is hindered by the intrinsic limits of conventional cancer diagnostic methods. Nevertheless, nanotechnology provides high sensitivity, specificity and multiplex measurement capacity and is therefore used for the detection of cancer cells in the initial stages. Other than the United States, China has also been leading the nanoscience and nanotechnology innovation to drive some of the world's biggest breakthrough. In July 2020, an international team of researchers led by Chinese scientists had successfully developed CRISPR, or known as Cas9, a gene editing tool capable of targeting, penetrating and altering cells to treat some single gene disorders as well as some forms of cancer. Other than that, scientists at China's Nanjing University also had developed nanoparticles to target and destroy abnormal proteins known to cause breast cancer by reducing the size of the tumors by half.
Thank you, Aisha. I'm Izzah Shakira and will explain about the challenges in developing and implementing the nanotechnology inside of Malaysia. Firstly, there are a risk that the nanoparticle may damage our lung. Several studies have shown that carbon nanotubes, which are very similar in shape or asbestos fibers, cause the damage to the lungs of rats. As we know, the respiratory system of a rat is very similar to a human. Therefore, the use of nanoparticle itself inside the human body is very concerning. Next, there are also concerns that once the nanoparticles are inside of our bloodstream, they will be able to cross the blood-brain barrier. This is because in some studies, the nanoparticles has been shown to lead to brain damage in fish and dog as they inhale carbon nanotubes that can suppress the immune system by affecting the functions of T-cell. The third challenge in developing and implementing the nanotechnology is that the nanoparticle can cause pollutions. The pollution caused by the nanotechnology is known as the nanopollution. This kind of pollution is very dangerous to living organisms. Next, the other challenges in developing and implementing the nanotechnology inside of Malaysia is that the limitations of available imaging techniques used to evaluate the morphology of liposomal formulations. Validating and controlling the morphology of nanoparticle is important for clinical translations. However, it is generally difficult to control the imaging technique of the nanoparticle as well as it is not well organized. Moreover, the nanodrugs are significantly more expensive to manufacture than conventional medicines. The overall cost effectiveness in comparison to current therapies are also not looking so good. I think that's all for the challenges part in developing the nanotechnology. I will be passing the floor to my friends, Husnina Kamra.
Thank you, Iza Shakira. Hello everyone, my name is Nur Husnina Kamra and I will be presenting on recommendations on how Malaysia should move forward with nanotechnology in cancer treatment. Firstly, Malaysia should improve in integration of technical and human capital infrastructure. The most crucial component to the success of nanotechnology is human capital. In summary, the Nano Malaysia Centre (NMC) requires an internationally competitive level of technical and human capital infrastructure to warrant success in the R&D. The management, application and implementation of nanotechnology in the industry in the next 10 years require highly skilled human capital and nanotechnologies. Therefore, the proactive medium-term plan of the Nano Malaysia Program (NMP) is to encourage public universities to offer undergraduate degree programs in nanoscience and nanotechnology in addition to the existing postgraduate programs. The establishment of Malaysian Nanotechnology Industrial Group (MNIG). MNIG will be established to bring together nano industry players in Malaysia and be the voice of the local nano industry. MNIG would serve as a collaboration platform between nanotechnology companies and small and medium enterprises (SMEs), as well as assist in intercompany coordination in the supply chain of nanotechnology products. MNIG will be the best platform towards the involvement of more industries in the field of nanotechnology to be able to penetrate the international market. The contribution of SMEs in the nanotechnology industry provides many socio-economic benefits to keluarga Malaysia that is creating 33,391 job opportunities besides contributing 151.5 billion ringgit Malaysia to gross domestic product. Other than that, enhancement of nanotechnology R&D activities. A growing number of groups are actively involved in nanotechnology R&D in Malaysia, the majority of which are from the higher learning and government research institutes. The committed support from the government seen in the increased R&D funding to Science, Technology and Innovation Ministry, mostly for nanotechnology R&D, enable the growth of a significant number of groups pursuing nanoscience and technology research. Lastly, public awareness. A successful campaign must be promoted towards greater public awareness on the impact of nanotechnology in the future economy, society and environment. Specific programs, which include seminars, public talks and exhibitions, are organized in order to inculcate nanotechnology culture to the society. That's all from our group. Thank you.